Hello and welcome. In today's episode of Dr. Noor, I have a very special treat for you. Yes, that is right. We're going to be doing anti-wrinkle treatment for a man. Let's go and invite him in and see how he gets on. Hi David, come in, have a seat.
Thank you.
Alrighty, so David, you are here for some anti-wrinkle treatment, is that right?
That's correct.
Lovely.
Yes,
and have you had that done before in the past?
yes, I have. Yeah.
And how did you go with it?
Yeah, it went all right, yeah.
Yeah. What areas specifically are you looking forward to getting
Just
today?
the smile lines and the forehead there.
Yeah, absolutely. Are you quite an expressive person? Do you use your forehead a lot and your eyes? Do you express quite a bit? Yes.
More than likely we do, yeah.
Yeah, for sure.
Not seeing it, yeah.
Yeah, and that very often is what we tend not to realise, and often it's your other half will notice it and say,
Yes.
oh, your lines are looking really strong now, but you don't realise because you haven't looked at yourself in the mirror, or we don't usually look at ourselves whilst we're expressing anyway,
No.
only if you're getting filmed or something like that. So yeah, there you go. Alrighty, and you're not a stranger to anti-wrinkle as we know, but we'll still go through a bit of the rigmarole if that's okay.
That's okay.
Yeah, do you have any particular questions that you want to ask me at all?
No, I do not.
Perfect. And are you well today in yourself?
I am, thank you.
Beautiful, great. So with the anti-wrinkle, so it is a toxin that is derived from the soil, but it's purified really down, and a very small amount is injected into your muscles. And essentially the way that it works, as you know, is that it stops the muscles from contracting, so they no longer can talk to each other. But that process does take a little bit of time. It can take up to 2 weeks for it to fully start working, but you should notice some changes in the next 3 to 5 days, thereabouts. And as we get on with time, those muscles will eventually start to contract and talk to one another again due to something called synaptic resprouting, which is a very long word, but basically it just means that the muscles will start communicating, and that's why our anti-wrinkle isn't forever, unfortunately. It does only last for 3 to 5 months, thereabouts.
Yep.
And as it is a needle that's going into the skin, there may be some bruising, maybe some bleeding as well. So after today, I'll give you some very clear instructions on how to deal with that.
Okay.
Very good. It's relatively safe, but there are some risks that we do need to talk about. Obviously, the bruising and the bleeding is one, but sometimes the product can migrate to different places and affect different muscles. So really important for today not to rub or touch the area so we don't get any product migration, because sometimes it can move from one place to another, for example, going and dropping the brow, and it can cause you with a brow drop. If that does happen, it's not the end of the world. It won't last you for the full 3 to 5 months. It'll be a lot shorter. Touch wood, we're not going to do that today.
I'll stand on my head then.
Yeah, pretty much. Perfect. So what we'll do is we'll draw up the product, and then we'll take some pictures and we'll get injecting.
Okay.
Lovely. Do you have any questions for me at all?
No, I do not.
Perfect. But before we do that, we're going to do our consent form. So I've got that for you to read, and I'm going to go and draw up some product. So for this particular patient, or for all of my patients, I use an application called Treatment Pad, which is really great because it has a static picture of their before, and it also has a live camera on the other side, and it does help me to work out what angles I am taking of the picture. And that just helps me to keep nice and consistent, so that when I do show my patient their before and after pictures, they're at a constant and they can easily see the images, and it just makes it a lot easier for them to understand and see what's going on. Okay, David, a few funny faces for me. Raise those eyebrows up as high as you go. Oh yes, look at those lines. I'm looking forward to your after picture. Alrighty, David, this is a manual bed, so hold on. I say to my patients, if you want to go to Dreamworld, don't bother, just come here, because this is like way cooler. Alrighty, so. Oh, we're having too much fun today. I'm going to just give your forehead area a nice clean with an alcohol wipe. Make sure that we're nice and clean. Perfect. So just for you guys out there, the muscle that elevates your eyebrows, which is this muscle, it's called the frontalis. It is quite a thin muscle, and it's just underneath the skin, and that's why you can see it so much when you do express your forehead. And it's quite simple to treat, but obviously it will have an impact on your forehead, so it will make you feel like your eyes are a bit bigger and you can't raise your eyebrows as much. So that's just a knock-on effect. Okay, now let's clean the eye area. Just look towards me a little bit. That's it. And raise it. Yes, wonderful. As high as you can go. The way that we draw our dots is to see where our areas are most expressive, and we never inject into the trough. We always inject into the valley because that's where the muscle is most contracting. And we draw the dots across the area. If I was only to inject down here, I wouldn't capture all of this area. And so you really want to go into a nice staggered approach so that we've got a full area. And I always like to do the Spock lines because very often you'll see people coming with a perfect forehead, but these weird little spocks here, and they don't look good. Alrighty, so 1, 2. Okay, and a big smile. And again, similarly as well for the smile, we never like to go lower than this plane over here, which is the Frankfurt plane. Otherwise, we end up dropping the smile. So that's from the tragus to the nasal flare. Never go lower than that because we don't want to drop that smile. Okay, you look like a work of art. Look like a work of art. Yeah, so with my white dots, I never inject into the white dot because I don't want to give my patient a white tattoo. So usually what I'll do is I use it as a marker and I'll either go above or below it. And then as I go along, I'll give it a bit of a wipe so that I know where I've injected, because as you can see, there are a lot of white dots over here, so it's really hard for me to kind of keep up where I'm going. So I always recommend just wiping off as you go, but never inject into the white pigment. Otherwise, the patient won't be too happy. Just look towards me a little bit, thank you. A good telltale sign to see where you've been is just to see where the blebs are, because naturally as a reaction you will get some red dots coming up after any injection. And last one. You did really well. Well done. Okay, and just looking towards me. So now we're injecting into a muscle called the orbicularis oculi, which is a concentric muscle around the eyes. And we only inject into this area over here. We can't inject too low down because you do end up hitting some other muscles, which can, as I said, drop the smile. And certainly we don't want to be going to the palpable part of the eyelid because that will also cause the eyelid to drop. So really careful with where you are injecting. But obviously you'll be going to a trained healthcare professional to get your injections done. Gotta say, your face is already looking like it's shiny. It looks good already, my goodness. Obviously that's not how Anti-Wrinkle works. It does take 2 weeks for it to work. Look at that, and just like that, your treatment is done. So I'm going to go through your aftercare instructions. So make sure you keep your head upright for the next 4 hours. No rubbing or touching of those areas. No makeup or lotion for today. Tomorrow everything resumes back as normal. Not a lot of exercise for today as well. And then you'll start seeing those changes in the next 3 to 4 days. Optimal results at 2 weeks, and we'll catch up and see how you go from there. Thank you so much for watching, and if you have any questions or comments, please don't hesitate to drop me a line in the comment section below. But for now, take care and stay healthy. Thank you so much, good sport.
Thank you.
You're most welcome. Let's pop you down. This is the fun part, remember? Hold on tight. This might convince my boss to get me an electric bed, maybe. Oh, sorry. Hey, there you go. Bravo.